This is Samantha Jellison of Securely Insured, and this is Medicare on the Mind. And we are going to briefly discuss the 2025. So my screen, I'm going to share my screen and stay tuned. Okay, so I am sure many people have heard the buzz about the Inflation Reduction Act. And this is a law that went into effect on January 1st of 2025. And what it mostly affects is Part D plans. And before this plan went into effect, if you are new to Medicare as of January 1st, most likely this probably won't mean too much to you. But for people who were on Medicare prior to January 1st, 2025, this act brought significant changes to the prescription drug plans of Medicare. And mostly what it affected was your true out-of-pocket costs, or otherwise known as TROOP. And also it affected the fact that there is no more donut hole. And we'll get into that in just a second. But to go back to your true out-of-pocket costs, before January 1st of 2025, the average true out-of-pocket cost, and that is going to be your co-payments for your prescriptions, your deductible, and premiums if you have a standalone drug plan. They all combined to create your true out-of-pocket costs, and for the most part they came down to your medications. We all know medications can be very expensive, and co-pays really do help to lower those costs. Prior to January 1st, 2025, the average, let's say before 1125, the average true out-of-pocket cost was around $8,000, meaning you would have to contribute upwards of $8,000 towards your medications. And basically the idea in theory was that once you and that would be considered your initial coverage stage. In theory, you would be moved to the catastrophic phase after you had reached that, but that didn't happen. We had something called the donut hole. And what the donut hole was you would actually end up paying more money for your prescriptions than you had been. And basically it would go around in this gap. It was basically a big coverage gap until catastrophic phase kicked in. And in catastrophic phase, that means that the insurance company, the carrier, they now pick up 100% of the costs of your prescriptions. So once the Inflation Reduction Act was introduced, the changes that were made were no longer having this $8,000. 125. It is now capped out at $2,000 annually, and it resets every January 1st. And there is no more donut hole. So once you have reached your $2,000 cap on your initial coverage stage, you immediately go into the catastrophic phase. So when you have reached your $2,000, now the prescription or the plan, the insurance company, they are now covering 100% of the costs of your covered prescription medications. Remember, the prescription has to be covered on the formulary in order for that to be affected by this. And another factor that was introduced during this was the prescription payment plan. And what that does is it gives you the chance to take your more expensive medications and from the beginning of January and spread the payment out over the course of the year. So you're now making payments on that first month of medication, but again, these all apply towards your $2,000 out of pocket cap. This is a super beneficial program, law that went into effect for people who are on very expensive medication, and a lot of them. Here's where I feel there was a downside to this, is that because now the burden of the financial part of this is on the insurance carrier, what we have seen is that quite a few of the prescriptions that were formerly covered on the formulary are now disappearing. So there have been many plans that have decreased the amount of prescription drugs or name brand drugs that were once covered, and now they no longer are. It has been their, so to speak, loophole to not have such a high burden financially with prescription drugs. Another issue that I feel we've been seeing is this, to me, seems to be a reason why many Medicare Advantage plans have been losing those additional benefits or diminished additional benefits, such as the dental, vision, and hearing allowances that came with those plans that used to be very rich, very good benefits, have now seemed to be dropping pretty consistently because the insurance company is essentially eating the cost, and now they're going to find a way to make it up in revenue, and that unfortunately involves taking away, other factors that would cost them money. It's why it was so important this year to do your due diligence and find a plan, whether it be a standalone prescription drug plan or a Medicare Advantage plan, that fit your needs as best as possible. And we're not sure what the effects will be going into 2026, 2027, and beyond. As a Medicare broker, I spend an awful lot of time trying to keep up on changes within the industry, so I will definitely be reporting anything here if there's any new news. But as of right now, if you found yourself in a plan that was not as did not cover you as well as you had intended, remember you do have that option come annual enrollment period, AEP otherwise known as, and that is from October 15th to December 7th every year, and it allows you to make a plan change. And our healthcare needs change year to year, so that's why it's also important to make sure that you are doing at least an annual drug plan review with a licensed professional who can guide you through making sure everything you need covered is covered and everything important to you is there and available. And that is, in a nutshell, the Inflation Reduction Act and what those changes meant this year. My name is Samantha Jellison of Securely Insured, and this is Medicare on the Mind. I look forward to chatting with you next time, and have a great day.